try and be around people that inspire you, work with people that inspire you, that are like-minded, that, believing in a cause, a mission is a much better way to go through a medical world, I think, than just, concerned about your overhead and how much money you're spending and how much money you're making and what your call, schedule is going to be. But truly, being concerned about a population, taking on a population, working at a facility that you believe is, has a mission, and like the 16th Street Clinic does, where you show up every day and you work with like-minded people that are there because they believe in the work and they want to help that community. That's a good way to spend your life, in my opinion. Again, there's just a lot of options out there. Don't be short-sighted. When I got done with residency, it was sort of this, do I go to fellowship or do I go out into private practice? I sort of saw that as the two options. But there's a million options out there. There's public health clinics, there's public health departments. There's so many options. It's just mind-boggling. But you have to explore them, you got to look at them. And again, because you're looking at these short little steps, sometimes you don't look very far down the road, but there's really a lot out there.
Number one, I was hoping to actually meet some pre-medical students and talk to them about what Loyola has to offer. And number two, just learn what different schools are doing to approach the communities and reach out and work with the communities, like different things that people are doing, so we can kind of work it in our program.
Yes. So diabetes is a major contributor to diseases of the heart and stroke. But to die from diabetes means that your end organ disease has to be very, very severe in some other area. Okay? Retinopathy, nephropathy, all these things that you hear about. And so the mortality risk is only 5%. But diabetes is rampant, and it does contribute to diseases of the heart. The other thing I would tell you is that the Latin American population in the United States is extraordinarily young. Okay? So this is going to change. Diabetes mellitus is going to go higher on the list, and diseases of the heart and stroke are going to get even higher in percentage. And right now, if you look at the literature regarding Latino health, there's all these papers that say things like urgency, emergency. We need to address cardiovascular health in Latino populations. And nobody's really tackling it the way that it should be done.
The reason I came to the conference today is, first of all, just the NLMS conference is a great opportunity for us to network. I think it's really neat to have the opportunity to meet other people. We don't have an opportunity to do this at our medical school, so coming to a conference where you see a lot of people with the same interests, it's a really good experience for us. Most of all, I think the most important thing that we can get out of here is just also learning about some of the different issues that are facing the Hispanic world today. And we need to be very open to the things that are affecting the U.S. and also how we can get involved in kind of making a difference with the cultures that we have.
Have the children understand what are their parents going through, and really thinking in what way all the family members can be participants of providing help to their family member. Something important to take into consideration, and because you probably lived the experience and might not think as much about it, is acculturation. Acculturation is you live through it, and all the Latino patients that you will work with in the future have also this experience. And it is an experience that can be very stressful, and it is in my line of work, it is so stressful that it doubles the rate of depression for Latino patients.
I think it's really very important to encourage just not only people who are of Hispanic origin at your school, but also everybody that you meet, that the Hispanic culture is really an encompassing one, a friendly one, and we want everybody to help out with all of the healthcare problems. It's not just us, we have a really great sense of community, and I think that's something that we want to share with other people at LMS, which is a way to do that, and also a way to bring undergrad students in and say, we want you to become doctors, we want to help you, to really just broaden that sense of community.
Put it this way, the department, they fly us out, like really offers pre-meds or medical students a lot in terms of getting to know people who've had all kinds of different experiences. I think that getting to know other medical students makes you a stronger medical student. I think that having an opportunity to meet upperclassmen, if there's not too many people that you get to know at your own undergraduate or your own medical school, is excellent. I think I've met some really nice people who helped me along with all of my questions and problems.
That makes such a big difference on your application, what you do at that time. Now you can either be like the majority of your friends who might be hanging out or going on vacation to Mexico or wherever, and just, or maybe just bumming around at home for the summer, or you can be like some of the more competitive applicants that we get year in and year out, who do internships out of state, who volunteer at a hospital or clinic, who dedicate their time, instead of sometimes even working. That's a big sacrifice too, because they need to get that exposure and they need to make that application a very competitive application. You guys need to make those decisions, so you actually kind of have to grow up fast if you decide to pursue this field, because that is what it's going to take. And we do think that you guys have it in you, and sometimes we come in to kind of give you the information that you need to make you realize your full potential. But don't be afraid to reach out as well. That's what we're here for. You have us at the Hispanic Center of Excellence. You have Dr. Bragg here at the College of Medicine of Wisconsin, Francisco at Northwestern. I mean, we're a team, guys, because like this the healthcare issues in our country is a huge issue and it affects every single one of us, both African American and Latinos specifically. And although this is a field that can be pretty competitive, we actually need to work together and help each other out. And that's what we have the Medicina Scholars Program. That's what we have the HCOE network, so that we can work together in pursuit of your goal to become future physicians.
I think it's important on a few different levels. One is that they have an opportunity to see that there are other mentors and role models for them to see that they can accomplish these goals. Also, it's an opportunity for them to see what is the process of becoming a stronger applicant for medical school. And then an opportunity to just see different medical schools, see what their facilities are, and different opportunities, start learning what different schools have to offer.
Looking for Latino physicians and health professionals is something that's important to me, and I think important to all of us here at the conference. And making sure that we have a strong network of minority health professionals on several different levels, whether it's undergraduate, medical students, residency, and beyond, looking to them and really coalescing together to form a community that can serve the greater good of it and really promote the core values of promoting Latino healthcare issues within the U.S.
organization. And one of the students found this on the web, and immediately we started to ask who wanted to come, signed them up, got the money, brought them here. The students now are so excited. They want to visit medical schools, they want to network, they want to be mentored. They're seeing themselves as part of a corpus, a real body of Latino professionals who are going to go out and to serve the communities in needs. And this is a spark, this is a flame. This is what they need to show them what they can do and to help them keep on track through those networking opportunities.